Hello, everyone. I'm Angela with Sunfish. We're live here with Dr. Liu. Hi, Dr. Liu.
Hi, everyone. Hi, Angela.
All right, so we'll just give folks a minute to trickle in, but I'll kick off with a few housekeeping items while we get started. Thank you for joining today's conversation. I'm so excited to be in conversation with the incredible Dr. Liu of Kindbody DC. We're going to be covering a few topics today, so I'll start with introductions. Then Dr. Liu is going to dive into a really common question, which is about the difference between IUI and IVF. These are two treatments that can support those who are trying to build a family, and we get asked about the difference all the time. Who's a good candidate for which, what it actually means to select one or the other. So we'll go into depth in that, and then I'll share a little bit about the new Sunfish program, which just launched at Kindbody DC. It's a flat fee bundle for people going through IVF, packed with tons of support and resources. So we'll share a little bit about how that works. All right, so really excited to be here with Dr. Liu. I, as you all know, am Angela. I'm the CEO of Sunfish. I'm one of the co-founders. I've spent many years in this field. Previously was a director at a really big fertility company where a lot of my patients struggled with affording and navigating the process. So my team and I started Sunfish to help make the financial and logistical components easier when you're going through fertility treatments, and we partner with clinics throughout the country, including Kindbody DC. So we'll share a little bit about Kindbody DC. The clinic launched in 2022, and Dr. Liu joined the clinic in 2023. She's actually from the DC area, but importantly, she is a really experienced physician. She studied at Cornell. She's a board certified OBGYN and board eligible reproductive endocrinologist, and is really dedicated to evidence-based care. So Dr. Liu, why don't you introduce yourself? Thank you for being here.
Thank you, Angela, and thank you for the kind introduction. So I'm Xiaohong Liu, or my nickname is Chen Liu. Often people have trouble pronouncing it, so they just call me Dr. Liu. I did grow up in the Maryland, DC region, and after I went to my schooling around the country, decided to come back to my roots here where my family is to help our local community. So I'm very excited to be here. I'm very proud of our DC Kindbody location, and I hope that with our partnership with Sunfish, that we're able to provide even more accessible care to our patients.
Fantastic. Well, with that, we'll dive into our conversation today. So, we have some visuals to help support this meaty conversation. A bit of housekeeping as I dive in. You're automatically on mute. You can chat us our questions using the chat feature at the bottom of Zoom. They'll be private to us. No one else can read them. I'll read them and facilitate throughout the conversation as well as at the end. And for everyone who's enrolled, we actually have some special discounts, which I'm really excited to share. So, with that, we've introduced ourselves, and I'll pass it over to Dr. Liu. Can you just tell us a little bit about your clinic and what makes Kindbody DC unique?
Definitely. So our Kindbody in DC is unique. We offer a very unique approach to fertility care. We focus on a very personalized and accessible treatment. Me and my whole team, we understand that navigating fertility care is a very deeply personal experience and requires a lot of trust in your physician and also your clinical team. So here in RDC, once you're linked into Kindbody, you have access to a network of very highly skilled reproductive endocrinology and fertility specialists. And our goal is to provide the best in-class care and to provide transparent pricing and a seamless patient experience. We offer flexible appointments, so with both virtual and in-person appointments to accommodate your needs. We often have patients, seeing me on their lunch break, on their way to work, etc. And we also offer very competitive pricing for any fertility treatments. And hopefully now with our partnership in Sunfish, that accessibility and pricing will be even better. Okay. And Most importantly, we are also very, very proud of our team and our lab, which has the most up-to-date technology that's aimed at patient outcomes and also safety. So
Fantastic. Well, thank you. And I've personally met a lot of the team. I can say it's a really wonderful group of people. So let's dive into the topic today. We always get this question, Dr. Liu, what's the difference between IUI and IVF, and how do you know which one to try first?
definitely. All right. So before we decide whether IUI or IVF is the best route, after the initial patient consultation, the first step in our fertility assessment is to do both female and male testing. So the female testing focuses on our reproductive organs, so our uterus, our ovaries, and our fallopian tubes. So that will include lab work to assess our ovarian reserve through hormones such as AMH, FSH, and estradiol levels. And it also includes an ultrasound to evaluate our uterus and the ovarian follicle count. Additionally, your REI may also order a hysterosalpingogram or an HSG, and that's used to perform to ensure that the fallopian tubes are open. The male testing includes a semen analysis, which is used to confirm that there's adequate sperm around, that there's enough sperm, that they're moving, and that they're properly shaped so that they can get to the egg and be able to fertilize the egg. So all the results from this testing will help us determine and tailor the treatment course.
Okay, fantastic. So, that's a really helpful understanding of the testing that's done. Can you tell us a little bit about the two procedures?
Yeah, so IUI or intrauterine insemination involves placing the sperm directly into the uterus, right, in the optimal location at the time of ovulation. It is less invasive, has a lower cost, and is often paired with fertility medications to induce ovulation or increase the number of eggs that are released. In vitro fertilization, on the other hand, is a three-step process. So the first step involves stimulating the ovaries to produce multiple eggs so that we can retrieve them. The second step happens in the lab. So once the eggs have been retrieved, we fertilize it with sperm and then culture those embryos for several days. The third step involves preparing the uterus to optimize it for the transfer of the embryo. The IVF also allows us to genetically test the embryos before implantation.
Okay, great. Then the last question we often get is, which one would be right for me if I'm considering the two?
Definitely. So IUI is indicated in patients who are diagnosed with unexplained infertility. So those patients that have gone through all the testing and everything has come back normal, but for some reason they have that infertility diagnosis. It's also indicated in mild male factor infertility, cervical factor, same-sex couples, or single parents who are planning to use donor sperm. IVF is indicated in situations in which a patient may have blocked or damaged fallopian tubes, more severe male factor infertility, low ovarian reserve, a patient who has undergone multiple unsuccessful IUIs in the past, or those who've had recurrent pregnancy loss.
Great. Well, I think that's a really helpful overview. So if you can just tell us a little bit on this page about key factors to consider, and then we'd love to get into some of the success rates from the two. Obviously, where we'll come in is when we start talking about budget and cost, but would love for you to talk us through some of the other considerations for folks too.
Definitely. One of the most key factors of fertility is our age, and it's just something that we cannot control. So our fertility declines with our age, and it happens more so after the age of 35. So the quantity of our eggs, the quality of our eggs decline as we get older. So that's a very, very important consideration. The underlying diagnosis of infertility, as we have referred to in the previous slide, will also determine the most optimal course between IUI versus IVF, how quickly you want or need to try for pregnancy, and our budget. IUI is much less expensive, but IVF does have a higher success rate per cycle. And then our family building goals. IVF allows us to embryo bank for future pregnancies. So if your desire is potentially for a large family, or depending on the age at which you're planning to start family building, those are all potential reasons why we may lean towards IVF versus IUI.
I'll let
Okay.
you take this one away.
Okay, and that brings us to success rates. So the success rates for IUI and IVF really depend on one's age and infertility diagnosis. The key takeaway from this slide deck, or this slide in general, is that IVF generally offers a higher success rate per cycle versus IUI. So for example, under the age of 35, average IUI success per cycle is on average 10 to 20%, but looking at IVF success per cycle for that age group is almost 50%. And then if we go into each age group, we see that there is a decline in the success rate per cycle, and but IVF on average still has a higher success per cycle. Okay, so for some people, IVF, may be the more reasonable starting point, but IUI may still be a good first step. And this all depends on your age, your diagnosis, and your family building goals.
Yeah, especially when you consider IVF being more expensive, you can kind of do the math and figure out what's right for you.
Exactly.
But I think this is a great segue into the next section, which is talking about the IVF Success Program and how we protect you if you do decide to go the IVF route. It's actually really important to look at this right-hand column here where you can see IVF is not guaranteed and it actually takes most people several cycles, which is why we're really excited to have this partnership with Kindbody. So if you decide to pursue IVF, which is usually a very common procedure that people go to a clinic for. We know that it can be costly. It's financially, logistically, and emotionally challenging. And I know this for a few reasons. I've actually been a patient myself. I've gone through 4 egg retrievals. But I've also been professionally in this field for a really long time. I mentioned I used to be a director at one of the largest fertility organizations and have looked at other solutions, felt like there was nothing really solving these issues for patients and making the process easier and financially more possible to navigate. So that's really why we started Sunfish. And just a little bit about the rest of the team. We're over 20 people now. We are really all committed to helping you build your family. For many of us, we've been through these procedures ourselves. This is really our life's work. And we bring our own personal experience, but importantly, expert guidance and a wealth of resources to support you as you're going through this process, designed by experts from consumer tech, lending, the medical field. We have a number of reproductive endocrinologists on our board as well. So I'll tell you a little bit about the solutions we offer, and this is just another option at Kindbody. So if you were to work with Kindbody, you would be presented a flat fee IVF package based on your unique needs and whatever Dr. Liu or your doctor recommends for you, with some customization. So this package will be priced based on whether or not you need an egg or sperm donor, if you want a double retrieval package. We also always add unlimited embryo transfers and some other a la carte options that you discuss with your doctor. But once you decide on that plan, it's just one flat fee for your package, which makes it a lot easier to navigate. This is an example. These are not actual prices, but once you apply for this package, everyone will qualify. And everyone also gets a partial money back guarantee. So in this example, this patient's guaranteed to get $5,500 cash back from Sunfish if you're not successful in the first try, so you can try again. We want everything included. We also want to give you this peace of mind. I know, having been through this process, that it's stressful emotionally, but the financial stress certainly doesn't help. So we want to take that off of you a little bit. And again, everyone qualifies, even if you're 42, have done IVF before, you can still enroll in this program, which is so unique and something that was really important to our mission and our life's work to helping fertility patients. We include unlimited embryo transfers. So whatever embryos you make will cover those transfer attempts. And we also include loans. If you do need to borrow this amount, you can pay for it up front. You can put some of it on a credit card. We also have financing options with really high approval rates. And we work with a number of different lenders. So you can work through Sunfish or through your local credit union, whatever you want will help you. Our team's wonderful. We have a whole intake team that's very familiar with your clinic, and they can basically talk you through all the different steps. And then lastly, we provide support throughout the process, which I'll talk about a little bit more. Um, and again, many of us have been through this process, so we know it's really difficult. We're here to be a full service team alongside your clinic. So obviously, the incredible team at Kindbody DC is going to be taking care of all of the medical components. But outside of that, we'll be providing you with flowers, sending you digital guides to understand how to prepare, for example, what to pack for your egg retrieval. We send along care kits, and then if you don't graduate on the first cycle, if you don't get pregnant on the first cycle, which we talked about those rates, most people do need a few cycles, you're getting that money back guarantee, and we'll support you to try again all the way until you have a live birth. We're going to support you all the way until you go home with a baby. Um, and so I think, this is a really important program for people to just have one extra resource, to have some extra choice if you're considering the process. I recently just supported someone who was a single mom by choice. She went through the process. She got with Sunfish. She did one retrieval, got three embryos, and the first transfer didn't work, which is very normal. It takes most people several cycles and multiple transfers. So she was really distraught. But our team was there. We were able to chat with her, talk through her options. A few months later, she was ready to try again. And of course, that next transfer was free because our program includes unlimited transfers. And she got pregnant on that next transfer. So she's now several months pregnant, about to go home with a baby. But just in case anything happens during the pregnancy, which of course is very rare and we hope it won't, but she has that peace of mind to know if anything does happen, her third retrieval would also be covered by Sunfish. So she's really getting that full protection. When we found out she was pregnant, our intake team and our care team are following along, supporting with every element of the journey. So they're celebrating when they saw her ultrasound photos. And lastly, a big component of the cost is medication. So you're paying the clinic for services there. You're also going to pay your pharmacy for meds. We actually have the lowest price guarantee on meds too. So if you see a better deal at a different pharmacy, the partnership that Sunfish has with Kindbody and our pharmacy that we all work with together will honor that price and give you the lowest price guarantee, which can add some additional savings. But importantly, your care team at Sunfish is going to be coordinating all of this with you, with Kindbody, with your pharmacy. So, we'd be really delighted to help you. I'll just give a little more color on the IVF process, and Dr. Liu, I'll ask you to chime in here. But these are really the full steps of the program. So, when you enroll with Sunfish, you would get that custom package based on what your doctor recommends and what you're interested in including. And that's one flat fee. We can help you finance it. Then you would go through your egg retrieval at your clinic. That's about 10 to 14 days of injections. Your eggs are retrieved, your embryos are created. We cover all of those costs in the program. And then you would transfer each embryo, usually one at a time, to see if you get pregnant. Once you hit around the second trimester, you would graduate to your OB, and Sunfish is going to stick with you all the way until you go home with a baby. If at any point you're not successful in the program, you would get that refund as well to try again. So, do you want to add anything on kind of the process and preparing here, Dr. Liu?
I think you did an excellent summary. I
Thank you. Been through it a few times, so
No,
yeah.
but I just want to add that this extra step and care from Sunfish, I think is really going to be very, very valuable and so special for the patients. It's a very provoking process, and you go through a lot of the ups and downs of emotions. Every single arrow looks very straightforward, but that path can definitely not be straightforward. Sometimes you go, back and forth. So just having like Sunfish as another support during this process up until graduation is I think going to be wonderful.
Yeah, absolutely. Great. And then just a couple Sunfish patient quotes. We really love hearing these from patients. These are some of the ultrasounds and baby photos that our shared patients sent in. And we just really love being a part of your full support, taking care of people, helping every step of the way beyond just the financial components. So this is our life's work. This is what really makes us happy to see. All right, so let's talk next steps and then we'll jump into a few of the questions that have been chatted in. Thank you guys for your questions. If you want to learn more about us, this is our shared URL. You can go here and set up a consultation with our team. There's a booking link right there to learn a little bit more. If you join or watch this webinar, we have a special gift for you. From now through the end of October, you are going to get a $500 discount on your Sunfish IVF Success package with this code. So just reach out, let our team know you joined the webinar. And similarly, Kindbody is offering 50% off your new patient consultation. So we'll email all of that to you. This is where you can find us. Kindbody on the top, Sunfish on the bottom. We would be so honored to support you on your journey. So let me pause there. We can address some of the questions that have come up. Let me just take a look. All right, the first one has come to you, Dr. Liu. I think you'd be the right one for this. Um, when is the right time to come and talk to a fertility doctor?
Think if the question crosses your mind, then the answer is now. But technically, for like the diagnosis and fertility, for patients who are younger than the age of 35, you meet the diagnosis of infertility if you've been actively trying to conceive for a year without success. If you're 35 years or over, that time window narrows. So if you've been trying to actively conceive for 6 months or more, without success. And those are definitely times to come to us. Okay. But you can come to us at any point.
Perfect. And then they asked a follow-up question, when should I speak with someone at Sunfish? That's a great question. I would say similarly as soon as possible. We can start working with you even before you've had your consultation with your doctor. Sometimes it takes a long time to actually get scheduled with a doctor. So reach out to us. Our team can help explain the IVF process, help get you financially ready, help kind of estimate what your costs will be so that once you do go in for your consult, you're actually ready to go. And we've been able to support a lot of patients in that way. Actually, most of our patients start within 30 days of contacting Sunfish just because we're able to really get you ready, which is a lot faster than the national average. It's usually 2 or 3 months. Um, okay, great. Next question. This one I think is for me. Does insurance cover IVF? So it really depends and it's very complicated. There are some insurance plans or employer benefit plans that will support IVF. Kindbody actually works directly with some employers. If your benefit is structured as a reimbursement, so you can use that with Sunfish as well. And sometimes your insurance might cover parts of the process, like your blood work and monitoring, but not the actual IVF cycle. So we can adjust all of the prices depending on what's covered. Anything you want to add to that?
No, I think you
Yeah,
did
I'm usually the
good.
finance payment person. All right, great. Then next question for you. Someone wants to know who you think Sunfish is right for. Who would be a good candidate for Sunfish?
I think that it's an important so you'll meet with me, so that's a clinical meeting, but then the next step from almost all the patients is the finance. So when is the right time to meet Sunfish? It's probably right as soon as we do our consult. And I think that even if you were not considering IVF, like it would still be a good time to meet Sunfish. Okay. If you are considering IVF as the next step, then definitely consider Sunfish because, like Angela said, human reproduction is kind of inefficient, and we do sometimes require multiple cycles to achieve our goals. And it's really easy for us to say that it takes a lot of cycles, but it's a lot of time and especially a lot of money involved. And hopefully Sunfish can help support that aspect of your care to allay some of the stress.
Absolutely. That was very well said. I agree. We really think everyone is a great candidate for Sunfish. If you're doing IVF, if you're trying to get pregnant, then please reach out to us. It can be before your consult, it can be after your consult with your doctor. We would love to help you come up with a plan, and we'd be really honored to work with you. Okay, great. Then next question. If you are doing IVF solo, what are some of the options for finding a sperm donor? What would you recommend?
Yeah, the next question would be, would you want to do anonymous, or we call it non-directed, or a directed sperm donor, which is someone that you know who may want to also be the sperm donor. So the two options are anonymous versus directed. Anonymous sperm donors, there are a lot of sperm banks around the country that you have access to. A directed donor, um, that process is a little bit more involved because there is medical, laboratory, FDA screening, and legal that needs to be done prior to the use of that sperm. Whereas if you use anonymous sperm donors, the sperm banks have already screened those donors and helped that initial process so that it facilitates and that initial process, and all you will have to do is purchase the sperm.
That's a really helpful answer. And if you are considering a sperm donor, or also if any of our listeners are considering an egg donor or a surrogate, we actually have a lot of resources on our website where you can learn about the process, but also the different costs. We actually have a whole financial hub that's free to use where you can go through and put in your information about what you know of your journey so far, and we'll present to you a custom guide that helps you think through all the components, the costs, how to get financial resources for that. So please check that out if you're considering third party. All right, great. Well, with that, we are almost at the end of time. Is there anything else you'd like to add, Dr. Liu?
Just that I'm excited for this partnership, Angela, and I look forward to, increasing the access to care and um, our wonderful partnership.
Thank you. I'm really excited as well. It's such an honor to be working with you and your team. I'll just put up really quickly once more the contact us page so that everyone can see this. All right, there we go. So once again, you do have a discount if you enroll before October 31st. This is how you can contact us. And if you'd like to learn more about the program, just visit joinsunfish.com/success program/kindbody. You can go ahead and set up a consult with our team. Obviously, if you want to contact Kindbody, just go ahead to their website as well, and you can set up a consultation online too. So, thank you guys so much for joining. Thank you, Dr. Liu. This was such a fun conversation, so informative. I hope that we'll both get to support a lot of you who've joined our webinar today in your family building.
Thank you, Angela, and thank you everyone for your time.
All right, bye.
Bye.